Welcome to Ulosca channel. Access all nursing practice questions. HESI Medical Surgical Hematological Practice questions with answers.
Question 1. A client with iron deficiency anemia is prescribed ferrous sulfate. What instruction should the nurse give? A. Take with milk for better absorption. B. Take on an empty stomach with vitamin C. C. Avoid fluids after taking the medication. D. Chew the tablet before swallowing. Which one is the correct answer? The correct answer is B. Take on an empty stomach with vitamin C. Explanation. Iron is best absorbed on an empty stomach and is enhanced by vitamin C. Milk inhibits absorption. Iron tablets should be swallowed whole and taken with plenty of fluid to prevent GI upset. Question 2. A nurse is caring for a client with sickle cell crisis. What is the priority intervention? A. Administer oxygen. B. Restrict fluid intake. C. Apply cold compresses. D. Elevate lower extremities. Which one is the correct answer? The correct answer is A. Administer oxygen. Explanation. Sickle cell crisis causes impaired oxygenation due to distorted red cells. Oxygen administration is the first priority to reduce hypoxia, which is a trigger for sickling. Question 3. Which lab finding is expected in a client with thrombocytopenia? A. Platelets 90,000 mm superscript 3. B. Hematocrit 45%. C. WBC 6,000 mm superscript 3. D. Sodium 138 milliequivalent L. Which one is the correct answer? The correct answer is A. Platelets 90,000 mm superscript 3. Explanation. Thrombocytopenia is defined as a platelet count below 150,000 mm superscript 3. A count of 90,000 mm superscript 3 indicates a significant decrease and increased bleeding risk. The other labs are within normal range. Question 4. A client receiving chemotherapy develops neutropenia. What should the nurse do? A. Avoid high-protein foods. B. Encourage frequent visitors. C. Monitor for signs of infection. D. Administer anticoagulants. Which one is the correct answer? The correct answer is C. Monitor for signs of infection. Explanation. Neutropenia is a low neutrophil count that significantly increases infection risk. Monitoring for infection is critical. Visitors may need to be limited to reduce exposure. Question 5. Which symptom should the nurse expect in a client with pernicious anemia? A. Night sweats. B. Smooth, beefy red tongue. C. Edema in lower extremities. D. Clay-colored stools. Which one is the correct answer? The correct answer is B. Smooth, beefy red tongue. Explanation. Pernicious anemia, caused by vitamin B12 deficiency, often presents with glossitis due to mucosal changes in the oral cavity. Other signs include fatigue and neurologic symptoms. Question 6. A client is scheduled for a bone marrow biopsy. What is the nurse's priority action after the procedure? A. Ambulate the client. B. Apply heat to the site. C. Apply pressure to the site. D. Position client on left side. Which one is the correct answer? The correct answer is C. Apply pressure to the site. Explanation. Applying pressure after a bone marrow biopsy is essential to prevent bleeding at the puncture site. This is a priority intervention immediately after the procedure. Heat may increase bleeding and is avoided. Question 7. Which dietary choice supports red blood cell production? A. Yogurt and bananas. B. Spinach and red meat. C. Chicken and apples. D. Rice and broccoli. Which one is the correct answer? The correct answer is B. Spinach and red meat. Explanation. Spinach and red meat are rich in iron and folate, nutrients essential for erythropoiesis. These foods help prevent or treat anemia. Question 8. A client with hemophilia A is admitted for bleeding. What is the likely treatment? A. Fresh frozen plasma. B. Vitamin K. C. Factor VIII replacement. D. Platelet transfusion. Which one is the correct answer? The correct answer is C. Factor VIII replacement. Explanation. Hemophilia A is a hereditary deficiency of clotting factor VIII. Replacement therapy with factor VIII is the standard treatment during bleeding episodes to help the blood clot properly. Question 9. Which finding requires immediate attention in a client with anemia? A. Pale conjunctiva. B. Fatigue with activity. C. Shortness of breath at rest. D. Hemoglobin 10 GDL. Which one is the correct answer? The correct answer is C. Shortness of breath at rest. Explanation. Shortness of breath at rest may indicate that the anemia is compromising oxygen delivery to vital organs and needs urgent evaluation. Other findings, while concerning, are not as immediately critical. Question 10. A client with leukemia is receiving chemotherapy. What oral care instruction is most appropriate? A. Brush teeth with a hard-bristled toothbrush. B. Use lemon glycerin swabs. C. Rinse mouth with saline frequently. D. Floss daily for hygiene. Which one is the correct answer? The correct answer is C. Rinse mouth with saline frequently. Explanation. Chemotherapy often causes mucositis, so gentle oral care is essential. Saline rinses keep the mouth clean without irritating mucous membranes. Harsh products or techniques can increase the risk of mouth sores and bleeding.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.